his or her heart may remain beating spontaneously. Which of the following factors decreases the body's ability to eliminate excess heat through evaporation? High humidity. When the outside temperature approaches or exceeds skin surface temperature, heat loss by blank and blank diminishes and eventually ceases. Radiation, convection. For evaporation of sweat to be an effective cooling mechanism, ambient air must be relatively unsaturated with water. In a cold environment, the body produces and conserves heat through all of the following mechanisms, EXCEPT. Hyperventilation. An increase in core body temperature due to inadequate thermolysis is called heat illness. Older people are at increased risk for heat-related illnesses because they are more likely to have chronic medical conditions that interfere with normal heat regulation. Which of the following medications would be the least likely to increase a person's risk for a heat-related illness? Alpha antagonists. A person taking levothyroxine is at an increased risk for a heat-related illness secondary to an increased metabolic rate. Factors that increase internal heat production include all of the following, EXCEPT. Hypothyroidism. Thermoregulation is a function of the anterior hypothalamus. Impaired vasodilation interferes with heat dissipation. All of the following factors contribute to heat cramps, EXCEPT. Gender. Heat cramps are caused by sodium loss due to sweating. The first step in treating a patient with a heat emergency is to move the patient to a cooler area. The most likely cause of heat syncope is vasodilation and dehydration. In contrast to salt-depleted heat exhaustion, water-depleted heat exhaustion occurs primarily in geriatric patients, and is due to factors such as decreased thirst sensitivity and immobility. Which of the following clinical findings would you not expect to encounter in a patient with heat exhaustion? Hypertension upon standing. The diagnosis of heat stroke is usually made when a patient has a high core body temperature and an altered mental status. Classic heat stroke typically affects older people and is not associated with exertion. In contrast to classic heat stroke, exertional heat stroke affects young, healthy people. Which of the following statements regarding thermoregulation is correct? Skin temperature can fluctuate a great deal, which is why it plays a major role in thermoregulation. Patients with heat stroke have a core temperature greater than 104 degrees Fahrenheit. Which of the following clinical findings suggests the cause of a patient's hyperthermia other than heat stroke? Intermittent chills. The most important treatment for a patient experiencing heat stroke involves removal from the hot environment and rapid cooling. Which of the following statements regarding frostbite is correct? Frostbite is an ischemic injury that is classified as superficial or deep. Cigarette smoking predisposes a person to frostbite because it causes arteriolar constriction. The most common symptom of superficial frostbite is an altered sensation. Treatment for a superficial frostbite injury includes elevating the frostbitten part, a deeply frostbitten extremity is cold, hard, and without sensation. When frozen tissues thaw slowly, partial refreezing of melted water may cause greater tissue damage. In addition to your transport time to the hospital, pre-hospital treatment of a frostbitten body part is mainly dependent upon whether the affected part has been partially or completely thawed prior to your arrival. In situations where the environment is a factor, the most accurate means of determining a person's core temperature is to use a rectal thermometer that is capable of measuring extremes of temperature. Hypothermia is defined as a decrease in core body temperature, generally starting at 95 degrees Fahrenheit. A patient may become hypothermic for all of the following reasons: EXCEPT, decreased thermolysis. Which of the following statements regarding shivering is correct? Shivering increases the basal metabolic rate by up to 5 times. A decreased wind chill factor increases heat loss through convection. A patient with diabetes would most likely experience heat loss secondary to peripheral neuropathy. Liver disease predisposes a patient to hypothermia secondary to inadequate glycogen stores. In trauma patients with shock, hypothermia interferes with the coagulation of blood. In mild hypothermia, an older person would likely present with all of the following: EXCEPT, shivering. The effects of hypothermia are most dramatically apparent in the central nervous system. Cold diuresis occurs when the initial peripheral vasoconstriction response in hypothermia is interpreted by the volume receptors as an increase in volume, causing the kidneys to produce more urine. The thermolytic tissues in the hypothalamus are mediated by the parasympathetic nervous system. In early hypothermia, the cardiovascular system typically responds with tachycardia. On the ECG, an Osborn wave can be recognized as a positive deflection immediately after the QRS complex. At a core body temperature of 90 degrees Fahrenheit, oxygen consumption decreases. Which of the following is not a form of passive rewarming? Applying chemical heat packs. Pre-hospital treatment for a patient with moderate hypothermia may include warm IV fluids and heat packs. If a patient with severe hypothermia is pulseless and apneic, you should attempt a single shock for VFib or VTACH. If you are unsure if a patient became hypothermic prior to developing cardiac arrest, you should begin resuscitative efforts. When a person experiences a crisis in the water, the amount of time the person can hold his or her breath depends on all of the following factors except the water's tonicity. Which of the following statements regarding freshwater and saltwater drownings is correct? Both freshwater and saltwater can lead to pulmonary injuries. If a small amount of water is aspirated into the trachea during a submersion event, laryngospasm occurs and temporarily protects the lower airway. The basal metabolic rate is MOST, accurately defined as the heat energy produced at rest from normal body metabolic reactions. The initial hypoxic insult associated with a drowning occurs from apnea. While attempting to ventilate an unresponsive, apneic drowning victim, you notice poor lung compliance. Which of the following would be the most likely cause of this? Diffuse alveolar collapse. Immediately upon gaining access to an unresponsive victim who is in the water, you should open the airway, using C-spine precautions if indicated. Other than personal safety, your most immediate concern when caring for a submersion victim should be the risk of vomiting and aspiration. In drowning victims, positive and expiratory pressure is used to prevent atelectasis and force fluid from the alveoli. During saturation diving, the diver remains at depth for prolonged periods of time. The most popular form of diving is scuba diving. An estimate of the pressure to which a diver is exposed is based on the depth of the dive. Gas-filled organs are affected by the pressure changes experienced during descent and ascent through water because they are compressible. Nitrogen causes decompression sickness on ascent because of the bubbles that form on reduction of pressure. Of the many factors that affect the basal metabolic rate, the most important factor is the person's body surface area. It is most pertinent to determine if the symptoms of a diving-related emergency began during ascent or descent. Other than using an atrox system, the only effective way to counteract nitrogen narcosis is to lower the nitrogen partial pressure through controlled ascent. Pulmonary overpressurization syndrome occurs when a diver holds his or her breath during ascent. Any diver who loses consciousness immediately following a dive should be assumed to have experienced an air embolism. What is the pathophysiology of decompression sickness? An imbalance of nitrogen in the tissues and alveoli due to rapid ascent. The most common clinical finding observed in patients with type 1 decompression sickness is joint pain. Shallow water blackout occurs when a swimmer hyperventilates prior to entering the water. Altitude illness is a problem caused by hypoxia due to low atmospheric pressures. Which of the following signs and symptoms is most indicative of acute mountain sickness? A throbbing headache and fatigue. A patient with high-altitude cerebral edema presents with ataxia and confusion after experiencing acute mountain sickness for greater than 24 hours. An increase in core temperature causes the hypothalamus to send signals via efferent pathways in the autonomic nervous system, causing vasodilation and sweating. Offering him oxygen, starting an IV with normal saline, giving a 250 to 500 ml fluid bolus, and recommending transport to the hospital for evaluation. Give oxygen, assess his blood glucose level, establish vascular access and give saline fluid boluses as needed, transport, and monitor his cardiac rhythm. Strip her to her underclothing, begin rapid cooling measures, assess her rectal temperature if possible, establish vascular access, and assess her blood glucose level. Prostaglandin inhibitors. Preventing further loss of body heat. Protecting her hands from injury with dry, bulky dressings. And transporting without delay. Move his wet clothing, apply warm blankets, administer supplemental oxygen, assess his blood glucose level and blood pressure, and start an IV with warm normal saline. Give a single shock, immediately resume CPR, place advanced airway, provide ventilations at 8 to 10 breaths per minute with warm humidified oxygen if possible, establish vascular access, and provide rapid transport. You are caring for a middle-aged woman who is pulseless and apneic. Per rectal thermometer, the patient's core body temperature is 90 degrees Fahrenheit. The cardiac monitor displays ventricular tachycardia. How will your treatment for this patient differ from that of a normothermic patient? Increase the interval between cardiac medications. Attach a portable ventilator that provides positive and expiratory pressure. Approximately 5 minutes following ascent from the water, a 30-year-old male diver complains of sharp chest pain and mild dyspnea. By the time you arrive at the scene, the patient is unresponsive. You should be most suspicious for an arterial gas embolism. The transfer of heat from a hotter object to a cooler object by direct physical contact is called conduction. The Hymenoptera family of insects includes blank, which usually cause death secondary to blank. Yellow jackets, anaphylaxis. Which of the following statements regarding the black widow spider is correct? Following a black widow spider bite, the patient's abdomen is often rigid due to severe muscle spasms. Pharmacologic management for a black widow spider bite may include diazepam. The bite of a brown recluse spider may not result in immediate symptoms but generally presents as a painful, reddened area with an overlying blister. Mortality and morbidity are greatest following the bite of a rattlesnake. The venom from a pit viper causes all of the following effects, except increased blood clotting. The most common and reliable sign of pit viper envenomation is rapidly developing edema around the bite area.